Say that using medical marijuana or cannabis is more of like an integrative approach. We want to complement what other doctors are already using. So let's just talk about kind of what kind of patients come to us, right?
Okay.
The state of Florida had a list of 10 different conditions that are acceptable, but then also they give us physicians a little bit of leeway to certify patients outside of that list if they have similar debilitating conditions, meaning they're just as equally disabled, or maybe the pathology, the way the disease progresses is the same. So, for example, patients would come if they have HIV, if they have PTSD, multiple sclerosis, ALS, glaucoma, seizure disorder, cancers or other terminal conditions, Crohn's disease, for example. So for a lot of number of different reasons, majority of our patients have issues with chronic pain, anxiety and depression, and insomnia. And those are the three main reasons to use cannabis worldwide. Actually, those are the three things that patients get probably the most significant benefits from. But to give you an example of our patients, and when physicians say that there's just not enough research, this is where I have a little bit of an issue with it. A lot of it is anecdotal. You can't put a price tag on quality of life. I mean, not a price tag, but you can't put like a study or a number necessarily.
Right,
so for example, patients who have Crohn's disease or inflammatory bowel diseases, they can't plan a trip to Miami without like planning where their restroom stops are going to be, right? So we've got patients that are coming back to us. Number one, they're not using budesonide or steroids or Humira, medications that are, have other, a list of other potential side effects. They're not using dangerous medicines. They're not counting their bathroom breaks. Their pain is controlled. We've got patients with Parkinson's or who have tremor. A gentleman who is like a professional golfer is embarrassed to bring a caddy because he can't even put the ball on the tee anymore. He comes in, first thing he says, "Dr. McCain, Rocksteady fired my caddy." Like it's the patients who are just feeling more, the caregivers whose parents are having a better night's sleep, so they're getting better quality of life.
Of course.
We've had patients who are disabled, who are collecting checks on SSI, who are now returning to the workforce. We've had a number of patients who actually opened up their own businesses. We had just the first patient this morning, wife says, "Thank you, we're not getting divorced," right? There's patients who are they're getting on the ground and playing with their children when before they couldn't even like get out of bed. So their pain is better, they're delaying surgeries. The examples are endless. And sometimes you're like wondering, well, is this just a placebo? Is this just, nobody can use the word miracle, but I mean, again, we had two patients who are on inpatient hospice and no other options, who came off and they got an extra year of life. Maybe another patient is still surviving where she was on hospice cancer. They discharged her because she's actually so much stronger than where she was before. So I've got tons of examples of patients who come back every day saying, it's just more so the quality of my life is better. And patients who are coming off of very bad medicines, we are fighting this opioid crisis. We are getting people off of their pain fentanyl patches. We've had a number of patients actually remove pain pumps because, cannabis actually seemed to do a little bit better than what the pain pills can do.
Amazing?
And really, we should be used with pain pills because it makes them more effective at lower doses. That's how we come off. So we should be working with pain management clinics and with oncologists because when cannabis is on board, they can go through their chemotherapies and beat that cancer. So we have a ton of examples of where it can be very, very useful. And we'll always take a look at charts without any cost to see if patients would be a good candidate.